Hi, I'm Nick Savdalis. I'm a psychologist by training. I'm a professor at the National University of Singapore and the academic director of the Center for Behavioural and Implementation Science Interventions. I'm also the academic director of the Master in Science in Behavioural and Implementation Sciences in Health.
My name is Yong. I'm an economist. I work in the areas of health, finance, social care. I'm an interdisciplinary researcher with a real interest in how impact is made in the world.
My name is Tiki Pang. I'm a visiting professor at the Yong School of Medicine. My own background is in microbiology, infectious diseases. I work for the World Health Organization, particularly in the area of evidence and information for policies.
As I was trying to study and improve healthcare processes in the context of surgical care or cancer care, I was getting, alongside my colleagues, increasingly frustrated that all the interventions that we're evaluating and producing were not routinely implemented, even in the hospital systems which were employing us at the time.
There's a lot of evidence that says it takes sometimes between 15 to 20 years before a product or an innovation actually gets used in delivery of healthcare.
There are reasons at many levels for why we don't see that change happen. We have individual biases, sometimes explicit biases that we're aware of, but sometimes also biases that we're not aware of. But we also have systematic barriers that prevent change from happening. Some of these are visible, some of these are less visible.
What implementation scientists do is they study the process of implementation. We do that via observing what people do. We analyze that systematically. We try and find what stops people from implementing a novel intervention or a novel pathway or a novel device.
It's not enough for us to have research. It's not enough for us to have scientific evidence. If that evidence doesn't make it to the bedside, it doesn't make it into the healthcare system.
So the value of BIS, if you like, Behavioral Implementation Science, is in addressing that very last step in the whole sequence of how science and research can improve health.
BISI is the first center that aims to bring together healthcare scientists who study implementation processes and behavior change in the context of healthcare. We wish to offer research, education, capacity development, and networking. We wish to be a place where people are coming together to discuss and debate and exchange ideas about what priorities we have to study in Singapore, but also more widely in Southeast Asia and beyond.
A healthcare professional who understands behavioral and implementation science will be able to better assess needs on the ground, to understand the complex circumstances in which they're working, to better design programs that work for their patients as well as their peers, and to think about how we evaluate those programs in a way that is rigorous, systematic, and helps the system to further change for the better.
Our master's program in Behavioural Implementation Sciences in Health is our flagship program that aims to deliver this high level of capacity development. It's a program that covers introductory, intermediate, but also advanced aspects of implementation behavioural science methodologies in the context of health and healthcare.
What we'll be giving you is a toolkit that includes both qualitative and quantitative methods and a combined lens for thinking about how to do this in a practical and effective way on the ground.
We very much look forward to welcoming you to our master program, to the National University of Singapore and to Singapore itself. You'll have a wonderful time. You'll be challenged intellectually and academically. You will learn a whole lot of new things, and you're going to have a lot of fun doing so.
Hi everyone, welcome to the first ever info session for the Masters of Science in Behavioural and Implementation Sciences in Health program, or the MScBIS for short. So I'm Leroy, I'm one of the admin staff working on the Master's program, and I'll be your host/moderator for today's session. Before we dive into it, I want to just show my appreciation to everyone for taking the time to come for this, our very first info session. So in case, if you guys didn't know, the August 2024 intake will actually be the Master's program very first intake. So this first info session represents quite a significant milestone for us. So on behalf of everyone working on the Master's program, I want to sincerely thank you guys for coming for this info session And we are really looking forward to sharing with you more about the master's program and hearing from you too. So for the first part, we'll have Professor Nick Satellis, who is the Academic Director for the Center for Behavioural and Implementation Sciences Interventions, as well as the master's program. She'll be sharing with you more about what Behavioural and Implementation Sciences really is. So Professor Nick, please.
Thank you very much. I'm very pleased to be here tonight. Launching this master's program is one of our major undertakings for this year, and I'm also very pleased because I really enjoy teaching on postgraduate level courses such as this one. It's a huge opportunity to learn from the interaction, from the questions, from the case studies that we will be presenting and debating. So for those of you who hopefully decide to join us on the Masters, I will be seeing you directly in lectures, in workshops, and indeed as a Master's project supervisor. So I'll be involved in all aspects of the Master's program with you. So just to get everybody on the same page, and I'm sure you all have a view and a vision as to what it is that you might wish to study by being here today. But let's just throw out some fairly broad and generic definitions, and let's start with behavioral science. So what is behavioral science? So if Leroy, you could move on the slides as I talk. Thank you. So essentially, we're talking about behavioral implementation sciences in the context of health, and that's quite important. So behavioral science in the context of health is essentially an approach that combines the insights and evidence that we have about human behavior from psychology, from cognitive sciences, from social sciences, in a way that helps us understand how people like you and all of us make choices in our everyday life, in our professional lives. So we throw these sciences and this evidence at healthcare providers, managers, systems administrators, funders, as much as we do to patients and members of the public, to try and understand their behavior. But as a psychologist myself, I can tell you that behavior is not only shaped by what's going on inside our heads, but is also shaped by the context in which we operate. Hence, we need implementation science. Implementation science has come to the fore for the last decade and a half, and essentially is an effort to understand how individuals behave within healthcare and health organizational structures, and therefore what we can do to support them to put together interventions that have really high quality evidence behind them, so that they can deliver them regularly, sustainably in the context of everyday care. And likewise, do the same with policymakers, so we understand how they can put guidelines into practice in a way that allows those guidelines to actually be followed in practice. Next slide, please. Now, the reason we need all of this is because we need to understand an individual in the context of the health or healthcare organization that they work. And this is what this master's is really about. It will give you a whole range of theoretical and methodological approaches for you to use in your workplace or in your research, if you're more academically inclined, or in your policymaking context, or in your ministry work, or in your consultancy work. We're going to talk a bit later about what sort of career directions you have following the master's based on experience around the globe. You need both sciences. You need the level of understanding of an individual, but also a team, a system, and how healthcare organizations and systems function as a whole. Now, the reason we bother about all this, and we're launching a whole master's program, the reason we have a research institute dedicated to these questions is because we really have a major problem globally in the context of health. Next slide, please. So we know that there's a huge amount of healthcare expenditure. We've got major challenges in the context of health, and this is not just applicable to Singapore or to Southeast Asia. People have discovered the need and value for behavioral implementation sciences across the world, because we often practice healthcare that is not quite in sync with the best evidence, or we do unnecessary tests, unnecessary investigations, which is exactly what's causing our healthcare bills to grow. Can you click on the rest of it, please, Leroy, so we have everything on the slide? We also know that there's a lot of really very well-intended and intentioned attempts from policymakers in particular, from ministries or for healthcare leaders to introduce change. And often these last for a few months or a couple of years, and then once attention is directed elsewhere, the implementation goes back to exactly what it was before. So there's no lasting impact. And of course, we also know that in places like in several Asian countries, Singapore is a great example, Korea is another, Japan is another, but the world over, healthcare, advanced healthcare economies have the problem of aging populations, which means we need to start thinking about prevention in a global manner, in a more holistic manner. And we also need to apply sustainable behavior change strategies at population level, so we improve health before people hit their 60s or 70s when healthcare expenditure goes through the roof. So we do need these methodologies to help sustainable delivery of what we know works, and yet we fail to apply in a consistent manner, either at population health level or at the level of individual patient care. Next slide, please. So essentially what we're proposing to you is that we're looking at a major challenge right ahead of us over the next 10 to 20 years. We're looking at major population shifts that require major, I would suggest, transformational change. Incremental change is great, and even that sometimes we get wrong. But we're now faced with such global challenges that we need to be applying methodologies that allow for transformational change, and leading that change requires knowledge of methods and metrics that will allow us to evaluate how effective, how efficient we are, and how we can prioritize where we spend our healthcare investment, how we train our staff, and how to support them to do what we're asking them to do, which is to provide the best evidence, care, and best practice on a daily basis to their patients and residents of large cities or countries. So next slide, please. These are the sort of challenges that other places in the world are also facing. This slide demonstrates that there's several centers and research units or entire departments dedicated to the study of behavior change in the context of health and healthcare organizations and implementation support structures. So you can see a big gap on the right-hand side where Asia is concerned. We are the first such center. We're dedicated, as you've heard earlier, to the study of these methodologies with a view to apply them to solve these massive, not just health or healthcare, but societal, I would suggest to you, problems. So we're following on from what is happening over the last 10 years across the rest of the world, and essentially we wish to be the leading center, and you're going to be studying with a whole range of faculty who are leaders in their own respective fields, and they're leading the world and implementing from the front, as it were. So managers, healthcare scientists, clinicians, you're going to be hearing case studies from people who have worked across a number of countries, who have worked in Singapore and elsewhere, and you're going to be able to contrast and compare and learn from experiences across the world. We have well-established collaborations and a number of emerging collaborations with several of these centers that you see represented on this slide. So we very much look forward to be tackling these challenges with yourselves. So for the rest of the presentation, if we go on the next slide, you're going to be hearing a bit more about the description of the actual master's program. I gave you the context in which the master's was set up and the challenges that we and yourselves are called upon to address. Now, I'm delighted to introduce you one of the senior members of our research group and one of the senior faculty members of the master's course. My colleague, Dr. Tina Chen, is the deputy director of the BUSY Research Center, and indeed is also a senior advisor at the Singapore Agency for Care Effectiveness, a doctor by training and an implementation scientist in the making, as it were. So delighted to pass you on to Tina to tell you a bit more about the contents and aims of our master's program. Tina.
Thank you very much, Nick, and good evening, everyone, or good morning, good afternoon, depending on which part of the world you're joining us from. Thank you very much for taking the time. Now, we've heard from Nick just now, as well as from the video at the start, if you managed to join us at the start, as to what behavioral and implementation sciences are and the very urgent problems that we're trying to solve. So having had a bit of understanding on that front, what I'm going to take you through now quickly is to give you an overview of the structure and content of our flagship new master's program. Next slide, please. Thank you. So I don't think we would really need to stress the learning objectives. I think the scale and pressing issues have already been made quite clear. But just very briefly, essentially the overall aim of our master's program is to capacity build, is to develop a specialized workforce within healthcare who have a level of excellence with regard to behavioral and implementation sciences. We envisage that these will be professionals who can apply State-of-the-art organizational and behavioral change methods, whether they are in leadership positions within healthcare or not, and whether they're based in Singapore or beyond, and that they are not just the doers or the influencers who bring about change, they also have the methodological and statistical knowledge and skills to be able to examine and evaluate how implementation has been done, both regard to the process of implementation and the outcomes or impact that the implementation has brought about. So it's really important not just to understand whether the implementation has worked, but sometimes even more importantly, why it has worked or why it has not worked, so that subsequent efforts can be made. Next slide, please. So an overview of our master's program. Now, in short, I'm going to be referring to it as MScBIS. So hopefully you'll catch on to that phrase. This is a master's program by Coursework. So 40 units or credits overall, with 7 core courses or modules and 7 elective courses to choose from. So because each course comes with 4 units, essentially you need 10 to graduate. So 7 core courses, and you can choose 3 from the 7 available elective courses. We're very proud to say that we will be one of the very first hybrid master's program that NUS has on offer. And what that means is that even though students will all be based in Singapore, we try to maximize flexibility in terms of mode of delivery. So we know that many of our students will be busy professionals who need to work during the daytime. So we try to deliver at least some of the courses online. And at the moment, the plan is to offer 2 of the available courses as either partially or fully done online. But rest assured, there will also be plenty of face-to-face, in-person interactions, and it is really important that we maintain that as part of the program, because a lot of the knowledge and so on is really learned tacitly through firsthand interactions with our distinguished panel of experts and faculty members. Next, please. So the target audience for this program. Now, I must stress that the list that you see here is not exhaustive by any means. These are examples of people coming from various backgrounds that we think would particularly gain from such a program. So these are professionals who probably already have been exposed to healthcare with a few years of working experience. These may be clinicians who actually provide direct clinical care to patients. These could be professionals who either run hospitals, who run clinics, or who run entire huge healthcare systems. So management teams, policy makers, thought leaders in healthcare. These could also be professionals who study, as I said, the process of implementation, or who help to design, plan, and evaluate various different types of health programs. Such programs could be based in the community, or they could be based in acute hospitals. They could even be professionals who are already very competent in conducting clinical research, but who would like to upskill or learn more about how to actually embed the findings of their research in everyday practice and policies. We also welcome people who take on a very hands-on role in the quality improvement space, or who wish to play more of a part in introducing or embedding evidence-based health innovations, practices, and policies in their everyday work. Next, please. So this is a 1-year full-time program. And if you're a full-time student, your candidature can last up to 2 years. And we envisage that most people will probably be doing this program part-time, as I said, probably busy working professionals, in which case the standard time frame is 2 years, but you can take up to four years to complete it on a part-time basis. And as Leroy said at the start, our very first intake or the program will officially start, the coursework will start in August this year, so very soon, and we're all very excited about that. Next slide, please. So to highlight the 3 unique features of this program, the first one is, as I said, we aim to maximize flexibility for our students. So even though the plan is for all of our students to be based in Singapore, we do wish to offer 2 of our core courses online, either fully or partially, but still with a lot of in-person interactions and collaboration space. Next point, please. So we are very unique in the sense that this is a program that very much combines, so it brings together for you to really operate at that intersection between behavioral science and implementation science. So some of you may have heard about behavioral science as a discrete field of study or research, and implementation science, on the other hand, is more nascent, and it's a field that's emerged more recently, and it's very much interdisciplinary. So implementation science inherently needs behavioral science and also a lot of other methodologies. So we really don't want to just look at the world through the lens of implementation science. All our students can really benefit from seeing the world through many different lenses in a combined way, and that will really enable you to better appreciate the complexities of behavior change and also the myriad of methods that you can tap into to bring about that change that you wish to effectively. So we're very unique in doing that, not just in Singapore or this part of the world, but globally as well. Lastly, our third unique point of difference is that, as I said, we've got quite a distinguished panel of faculty members, experts, industry leaders, researchers, very much people at the forefront of their respective fields whom you will learn from. So some of them will actually be giving you presentations. Some of them might be mentoring you through the project that you will be doing, which I'll tell you more about. And these are very much people who practice in the real world. So they will not just be telling you about theories and what might sound good, but very much firsthand experience with challenges, obstacles they faced, and realistically how to actually address these issues, but in a culturally sensitive way, judiciously as well. Next slide, please. So I'll pause here for a few seconds in terms of showing you our list of core courses. So these are the 7 core courses that one must complete in order to finish the master's program. So I'll just pause here so that you can read. And I'll take you through them. So essentially what you can see here is we do have a mixture of core courses. Now, number 1 and 3, I think from their titles, pretty self-explanatory. These are like the core of the core. So very much the essence and exactly what methods, what approaches, what principles, what frameworks are involved in behavioral and implementation sciences. Number 2, the course that's sandwiched in between, evidence-informed practice and policies in healthcare. These are to do with understanding how certain recommended practices and policies come about. So these are very much the interventions that behavioral and implementation sciences serve to do, to roll out to address, to get more people to take up in routine settings. So you need to have an understanding as to how they come about, their provenance, the processes, in order to be able to implement them well. Number 4 and 5, so the intermediate level research methods and program evaluation, these are very much tools or methods that you need able to actually do behavioral and implementation sciences. So they go hand in hand with the core of the core that you need to learn. Now, some of you may already be asking the question in your head, if not already in the chat, which I don't have time to look at right now. Why is intermediate research methods a core? What if I need to start from the basics? Now, we kind of set our starting point at intermediate because we would imagine that most students coming into the program probably would have had at least some exposure to both quantitative as well as qualitative research methods that are relevant for behavioral and implementation sciences. Hence, that's our common starting point. Don't worry if you haven't really been exposed to such methods, because you will have the opportunity to take the fundamental level research methods as an elective at the very start of the program. So I may share more about that when we get to the next slide on our elective courses. The very last 2 core courses that you see on the slide, Master's Project 1 and 2, now these are called 1 and 2, even though you will only take on one project throughout the entire program. The reason why they're called 1 and 2 is so that you will take them throughout all the semesters or through at least 2 semesters, and that will ensure that you have sufficient time as well as continuity to be able to complete the project. I'm sure that's not difficult to imagine that if you only took the one semester to do the project, I think everyone would be extremely rushed and stressed trying to complete that in an extremely compressed time frame. So we really hope that students will have the end-to-end experience as much as possible. Hence, we want to do that spreading out throughout 2 semesters. Next slide, please. So, of course, this slide then shows you our list of elective courses. And similarly, I'll pause for a few seconds so you can read through, and then I'll run them through with you. Okay, so if you remember what I shared earlier, so you need 10 courses to complete the program, and we already have 7 core that are compulsory. Hence, the idea is you would select 3 from the 7 elective courses that you see on the screen. We have 2 specialization tracks, which I'll elaborate on the next slide, but just to give you a flavor. So you'll see color-coded. We have a research track, and the courses that belong on the research track are shown in green, and also a practice track, and these courses are shown in blue. So if you already have particular thoughts about which track you might want to specialize in, then these will be the recommended electives that you take. So research track involves behavioral decision sciences. So basically, this course touches on how people make decisions, how people should make decisions, and what people actually do when they make decisions. The other one is the advanced research methods, and I think that title is quite self-explanatory. If you choose to do the practice track, then the 2 kind of mandatory elective courses to take would be number 3, the advanced applications of behavioral and implementation sciences. So these, so number 3 is meant to showcase real life examples. So projects, programs, initiatives that have been done in Singapore and internationally as well, that very much demonstrate how behavioral and implementation sciences are used to design, execute, and evaluate large-scale health programs. And number 6, advanced value-based healthcare. This one is about looking at managing healthcare with a focus on health outcomes in relation to how to best use the limited resources that are available, both in terms of cost as well as manpower. So this has a lot of implications for how one might want to use behavioral and implementation sciences. The other 3 elective courses, so number 2, that links back to what I said earlier. This is particularly for students who don't have a prior exposure to either quantitative or qualitative research methods. So the idea is that they can do that. And this course is really an accelerated one at the very start of the program to get everyone to that common starting point of intermediate research methods. Number 5, digital agility and change leadership is all about digital transformation, the role or roles that digital technology has to play, and how to bring about change in a rapid way alongside digital transformation. Again, a hot topic right now, including in healthcare, and a lot of implications for behavioral and implementation sciences. And the very last one, number 7, is to do with standardizing, structuring, and processing medical or health data. So if you come from a background that's particularly quantitative, and perhaps you are already in a role that's to do with health analytics, insights, and so on, this will really add to your toolkit. And also you can then connect that to what you've learned about behavioral and implementation sciences to really realize the insights in practice and policy. So I've really taken some time here to take you through, and hopefully that means you have a good understanding as to the structure and content of what the program will cover, and hopefully preempting some questions that might come in Q&A at the end. So next slide, please. So as promised, a bit more on the track specialization. First thing to say is it's not a graduation requirement. So you're not forced to choose a track. But if you already have a good sense of what sorts of things you'd like to do with behavioral and implementation sciences down the track, then this will really elevate your level of learning. So you can see the recommended elective courses, both for the research track as well as the practice track. And the idea is, so if you're pondering, you're not sure whether you should specialize in one track, and if so, which one to specialize in. A good rule of thumb to keep in mind is, if you're thinking about, you playing the role of being the active implementer, so I want to be the one who really drives, or who is going to be doing the doing, to be delivering the evidence-based treatment, to be running, say, the large-scale health program that is community-facing, then generally that's probably more tending towards the practice track. So you are the implementer, essentially. For the practice track, you would ideally be in roles that would require you to study, to examine, to evaluate the implementation process and outcomes. So whether you envisage to have actually a research-oriented career in academia, or actually in the healthcare industry, but very much like a research-oriented project consultant, and so on, we would recommend you to consider the practice track. Okay, next slide, please. So my very last few slides would be to kind of delve down into even the more specific picture of giving you a sense of what your timetable is going to look like. So the slide that you see in front of you is for a typical full-time student. So the idea is to complete the program in 1 year, spread across 2 semesters. And you would do an average of about 5 courses per semester. And you can see, so semester 1, you would do 4 core courses and 1 or 2 elective ones. And then semester 2, you'll be doing 3 core courses and 1 or 2 electives, depending on how many you've done in semester 1. Next slide, please. So for a part-time student, typically it would take 2 years to complete the program spread across 4 semesters. So what you see in front of you is kind of the typical example timetable for year 1 of 2. So year 1, and on average, you'll be doing about 3 courses per semester. So year 1, semester 1, 2 core courses. And if you need to do the introductory research methods, that's when you'll be doing it. Semester 2 of the first year, you'll be doing the 3 core courses. Next slide, please. Second year, semester 1, 1 core course. 1 core course and the option of doing another core one if you haven't done it. And then maybe 1 or 2 electives. And then the very last semester, the idea is to kind of front load a bit more so that you have more time towards the end. So hence the very last semester, the load would not be as heavy. You will be doing 1 to 2 elective courses. So I believe that's my last slide. I'll be handing over to my colleague, Mr. Tong Xiaochen, who's the Assistant Director at BISI. And BISI really stays true to the idea of behavioral and implementation sciences very much being interdisciplinary. So Xiaochen actually comes from a biomedical engineering background and then also worked in healthcare administration for a very long time. So he's going to take you through to provide further information about the program and also related courses. So Xiaochen, please.
Oh, thank you, Tina. So next slide, please. So I think one of the things that you've just set through basically what the full masters would be like. And I can understand that some of you might start feeling, I'm not quite ready for the full masters. What can I do? Am I allowed to take it in bite-sized pieces? And the answer is yes. So under the masters, we will be offering 6 executive certificates, which are actually stackable ultimately towards the masters. So these would be the 5 courses that 5 core courses that Tina had covered earlier, but also including the fundamentals of behavioral and implementation science, but also the introductory research methods as well. Given that especially for some of you, part of the trepidation that we have heard from feedback is that we need to take it a little bit slower, and so that's why the introduction research methods is also one of the 6 courses that we will be offering. So each of these will be 4 units each, and you can take these and stack them towards ultimately getting the masters, so you can learn a little more towards your own pace. So that is one of the things that we will be allowing. Of course, by doing this, you can also next slide, please. So one of the other things that we can do is we are offering 2 graduate certificates where we've already stacked 3 of the modules together, which you can actually take the time to learn. So once you have covered 3 of these courses under the executive certificate, you will be awarded a graduate certificate. So one would be more on the fundamentals of behavioral science that will include the fundamentals of behavioral implementation science, evidence-informed practice and policies, and introductory research methods. And the intermediate course, which would start with the intermediate research methods and the intermediate level behavioral implementation sciences, as well as program evaluation. So really, you can take up to about 24 units for both graduate certificates. And after that, if you decide you want to continue to do the master's degree part-time, that means you have about 16 units left to cover for the master's per se. So this would be how we would actually, these are how, if you want to take them in more bite-sized pieces, you can, and still get some level of recognition for it, which I understand is quite important for some of the employers when you talk to them. Okay, next slide, please. So one of the other things that I think a lot of people have been asking is, what can this master's do for us in terms of career prospects? So we have also, while designing the master's, actually have been consulting with some of the different players in industry, partners, and NGOs. And we shared the curriculum with them, and we actually then asked them whether would they want to hire. And these were some of the employment prospects that they had shared. So I'll probably give you a few minutes just to read through the employment prospects and the employment agencies. Yes. So we do want to assure you that we have been already talking to individuals who are interested in taking on our master students, and they actually also provided some really useful input on what are the things in the curriculum that needed to be there for them to to ensure that our graduates are employable. And the other thing I do want to rest assured is that we do want to make sure that the value add is there once you graduate from the master's program. And so so there was extensive consultation with these types of employment agencies just to make sure that the career prospects will be there. Okay, next slide, please. So one of the other things that we wanted to emphasize is our teaching faculty. So the 3 represented here are actually quite representative of the rest of the faculty that we would have. But these are also the 3 who already initially conceptualized a lot of the master's program and provided the vision towards it. So as you can see, there is a mixture of both academics, but also with familiarity with the industries, consultancies, and other and also in terms of leadership. So Nick and Joanne, you've already seen in the interviews, but Robin is also one of our senior leaders at Busy, and she will also be providing some lectures and played a key hand in helping to design some of the curriculum so far. Next slide, please. So these are also some of the other faculty that you will be encountering. You've already met Tina. Prof. Gayatri is another person who will be leading you guys through at least part of the fundamentals and intermediate parts of the behavioral design. Prof. Tiki Pang will be the one who you also saw in the video, will be leading you guys through the policy and evidence-based practice modules. And he has extensive experience with WHO and will be able to bring a lot of his wealth of knowledge from the international scene to the masters as well. So yeah, next slide, please. So apart from the people within the faculty, we are also drawing from our fellow schools within NUS and also even outside NUS as well, for people to be able to provide guest lectures and also to come in to teach for some of the courses. So for example, I mean, Prof. Vanetta is one of the people who we are asking to help to teach on the fundamentals of qualitative research, together with Prof. Chan Siu Pang, who is also a very experienced and quantitative researcher who has experience both in the academic setting and as well in the healthcare setting as well. So suffice to say that we have a very nice mixture of both senior healthcare leaders, experienced project managers, consultants, embedded researchers, all these to bring in a wealth of experience and a wealth of knowledge to make sure that the examples are not just theoretical, but to provide real world answers to some of the questions that you might have for them. We do also have made efforts to reach out to a national teaching faculty, at least, and also really international as well. So to be able to provide at least some degree of expertise and experience both within the NUHS cluster, but also outside the in Sync Health and Energy and other places as well. Okay, next slide, please. So now I would like to then hand over to our main program administrator, Ms. Jen Ye, who will take you through the end of the presentation.
Hello, everyone. Good evening. Thank you, Xiaochen. So here is where I'll talk to you a little bit more about the administrative requirements to apply and to get yourself into our course. After hearing so many exciting things shared by Tina, Nick, and Xiaochen, I will share with you other more pertinent information if you're thinking about applying and going forward with submitting an application with us. Can I have the slide, please? So in terms of the minimum academic application requirement, we will require an undergraduate degree in any of the health or healthcare, social sciences, social work, even psychology or any related fields that you already have. To apply to our program and you wish to have a little bit of advantage over other people, we will consider degrees from life sciences, particularly in the field of biochemistry, cell bio, molecular biology, bioengineering, and health sciences as an advantage because after all, this master degree was designed with the health and healthcare sector in mind. So if you have something under your experience or from your previous education background that relates to this area, then definitely your application will stand out a bit more with us. We also want to attract individuals who are thinking about doing a mid-career upskilling. So if you have any kind of work experience within health or healthcare or health-related research, we welcome your application as well. And this will also make your application stand out a little bit more amongst your peers. For individuals or applicants who are joining us from overseas and your native language or your original degree program was not taught in English, there is a requirement about your own language proficiency, which I think is pretty standard across all NUS master degree programs. So that is a basic requirement with us. In terms of other requirements that we have for the application, we want to see a personal statement of about 300 words from you telling us about your own strength. What are your career goals? What are your key research interests or academic research interests, or career development options or long-term goals for yourself. And we also want to see a copy of your CV so we can have a better understanding of who you are as an individual, where you come from, and that help us to decide whether your application or doing this course would truly benefit and how you achieve your lifelong goals. If you're not sure about any of the application requirements, whether your basic degree program is suitable to apply, or if your years of working experience is relevant, I invite you to write into us either through our master degree website. There is a contact form. So if you fill up that form and submit, we will receive your query, or you can email your questions directly to bisi@nus.edu.sg, and we'll get back to you within 48 hours. This I can promise you. And also, on top of one final requirement for your application, if you're thinking about doing it, is we require at least one reference letter from a referee. You do not need to get the reference letter yourself. When you go to the application portal, there is a function for you to check and input the contact details for your referee, and the system will contact the referee directly through the portal. So there's no need for you to submit the reference letter separately. Can I have the next slide, please? So another very important information if you're thinking about applying is what are the course fees. So I think our master degree program is priced very competitively and very comparable to the rest of the master degree programs by Coursework within the School of Medicine. So before GST, it is $54,000 for the full course. So whether you're doing this program as a full-time student or a part-time student, you will pay the same amount of course fees. The difference is within the duration within which you will pay the school fees. So if you're a full-time student, you pay the full amount across 2 semesters, meaning within the same academic year. If you're a part-time student, this amount will be paid across 4 semesters, across 2 academic years. So you simply take the figure and divide by 2 and then divide by 4 respectively. Good news for Singaporeans and PRs. If you're a Singaporean PR but you did not graduate from NUS, then you are able to receive 10% tuition fee discount offered by us. If you are NUS alumni, whether you're a Singaporean or PR or a foreigner, you will get 20% discount on top of this school fees. So this is something that you may want to take into consideration. I see some questions in the chat about scholarships and funding support. So these are the 2 options that we have available for NUS alumni and Singaporeans and PRs. So the application period is actually right now it is open. We open on Valentine's Day because we are very fun and we are very loving people. We open on Valentine's Day. For international students, the application will close end of April because there's a little bit more steps and processes involved in getting you to join us in NUS. For local students, the application will actually open all the way until end of June. If you have any question about whether there is any allowance to extend the application period for you due to special circumstances, please write into us using the 2 ways that I mentioned before, email directly to BISI, or you can fill in the contact form on our master degree web page. So again, just before I end, can I have the next slide? Can I invite you, if you have any other questions or you want to stay in touch, please scan the QR code that's currently on screen to visit our course page. And if you're really keen to begin your application right now, you can also scan the QR code at the bottom to apply through the graduate application system in NUS. And also on top of this, if you are thinking of maybe this is something that I want to consider doing in the future and I'm interested to find out more about what is behavioral implementation science, who is busy, what does busy do, what other works other than teaching, training, what research projects we have at the moment, stay in touch with us through our social media platforms. So we are on LinkedIn and we're also on X. So if you scan the QR codes presented on the screen right now, follow us, and then you will receive regular updates through these channels. We also have a mailing list. So again, if you fill up the form on our website, you will automatically join our mailing list. And any updates about any short courses that we do, any updates to the master program application, any webinars that we have coming up, you will receive all of this information straight away. Now I pass the time back to Leroy.
Yeah, so I think with that we come to the end of our first ever info session for the master's program, and really huge thank you to everyone for coming today. I know it's like a 2-hour session, but really thank you for coming and supporting us, and huge thank you to the speakers for taking the time to talk to us. I'm sure you guys are like very thirsty and hungry now. So yeah, so let's just wrap it up very quickly. Like I mentioned at the start, if you guys have any other queries, do email us. I've inputted the email below. And you can also fill out the contact form, which is located on the master's website. And yeah, once again, just thank you to everyone, and we hope to see you in class in August. Yeah, good night, everyone.